So one of the projects that we're involved in, really mentioned, is the Spread Partner Care program, which is the population, small amount of population, largest amount of health spend. And those folks are sometimes labeled super utilized within the healthcare system. And what we learned is that, or are learning, I should say, is that the intensity of intervention is enormous to get these folks to the health outcomes that we want to get them to. We have care coordinators or nurse practitioner level working with these folks, probably a ratio of 1 to 75. And these individuals have even given them cell phones, so they have 24/7 access to them for their needs. And what they found, of course, in going into their homes and such, is that we're not going to solve all this with clinical care. There's an awful lot there. There's transportation needs, there's nutrition needs, there's employment and income situations, there's violence, there's all kinds of other factors that are affecting the ability to get these folks to a healthier state. So through that work, it's opened our eyes, it's opened our awareness that providers and provider systems can't do this alone. And so we've got to tightly integrate with public health, with community organizations to get at these other social determinants of health. And we're proud to be a strategic partner with the HIPC program that Terry Allen is leading here in Cuyahoga County, which is going to start addressing that integration between providers and public health. And they're rallying around 4 strategic priorities, one of which is better management of chronic disease. And, we think that we'll be able to start to move the needle on some of those issues. Okay?
I want to ask a question, Thom. You had talked about college students ending their lives. Something I've been working on in the Very Good Safety Club is there anything being done at earlier ages? I think that I'm working with 3 to 6th graders and looking at doing mental health students at that point. Because I think parents are very confused. Is my child just misbehaving? Are they on drugs? Are they influenced by social media? So I think attacking these barriers or anticipating things that can go on and getting feedback early. When you're in college, it's kind of too late. And trying to reason with people to be irrational is difficult.
I would agree. I think intervention really has to take place at infant and toddler. And many people that I've worked with in the mental health system have said that when preschoolers being kicked out of preschool because of their behavior, and you start to take a look at the whole picture, you find out that that child's not going to the doctor, that child's family is struggling, maybe they're the working poor, maybe they don't have meals and food. I mean, there's so many different factors, and I think it addresses both the economic issues as well as the vulnerabilities, and this stress vulnerability theory of mental health, which is that sometimes these mental health things surface at various points in your life when the stressors in your life and in the environment are higher, and they're going to be higher in those situations. I don't think we should wait until college and university to intervene, but I think we have to have a multi-pronged approach, that there's some intervention at preschool, there's some intervention in 6th and 7th grade. We're talking about addiction disorders, we're talking about the onset of mental illness occurring in the early 20s, so there's a period there. And so I would use more of an intercept model. How many places can we intercept on healthcare needs in the lifetime? I just talked to a gentleman this morning about how we've really got to focus more on the elderly, and there's an alarming rate of suicide amongst the elderly, and yet I think as we look at the needs of the elderly, we don't often think about the depression that they've been able to hide most of their life, or the other kinds of mental health issues that go along with chronic illness. So this co-occurring, the person is made up of a mind and a body. And when you're physically sick, you're mentally also stressed. And if there is a place for an emerging mental health problem, it can occur at any point in your lifetime. And we're all mentally ill and we're all mentally well. And it's to the degree that we take care of ourselves just like we do physically. And so we have to take a look at it differently. So therefore, in schools, for instance, and I was a school board president for 10 years, so I believe that we need to pay attention to non-academic supports if we want better academic performance, not just better math, better reading, those things, but also how do we support young people? Because you can't learn how to read if you haven't had a breakfast, or you can't learn how to read if there's been fighting or violence in your life. So I agree with you that we have to have an intercept model that looks at all ages.
Samantha?
Yes. What role will your organizations play in the My Care Ohio demonstration, and how will you use this demonstration to affect better health, better outcomes, and lower costs?
The My Care Ohio is the Medicare Medicaid dual project.
So, our organization has, a significant number of folks who fall into the dual eligible category, and also has a significant percentage of activity around providing care to folks who have significant or specialized medical needs. So we see the dual eligibles as an opportunity, but it will require development of the model that I talked a bit about earlier, which is a complete care path, care coordination model to provide not just the intensive medical resources that are required, but really to make sure that you coordinated care amongst caregivers, coordinated community resources appropriately, because many of the issues in this population, in addition to being medical, are social, psychosocial, and you've got to have that complete system to provide the care. The second aspect of it is, as you think about care transformation, is providing payment support so that the other aspects of care that are essential to creating an improved outcome are available as well. So these kinds of programs are very important, and we're looking at the dual eligibles as another opportunity to help a vulnerable population, but do so in a complete and comprehensive way rather than sort of the fragmented approach we have at the moment.
So the funding will be provided.
So we're looking at it, and it's part of our plan to evaluate.
Well, I want to thank our panel again. Let's give them a round of applause. And thanks again to Greg Moody for sharing his innovative agenda, and to our host, the Cleveland Clinic, and our sponsors, KeyBank and Nordson, as well as Mount Sinai Foundation, Metro Health, and Jones Day. And finally, thank you to you for attending this last session of the Center for Community Solutions 71st Annual Human Services Institute, making it our largest for this year. Today's discussion was videotaped and will be posted on our website later on today at www.communitysolutions.com. Our next event is Friday this week, November 8th. Join us for a celebration of human services where the most treasured volunteer as well as the Annis Field Wolf Memorial Awards will be presented. And our keynote speaker at that event will be Justin Bachman, a Solon 11th grader who knows what it's like to be different and knows how important it is to make a difference. Justin uses strength and courage to rise above the many challenges that come with Tourette's syndrome, severe ADHD, and dysgraphia. In addition to his traditional volunteer service, he has just started a new annual Northeast Ohio tradition called the Tolerance Fair. So please join us for this event on Friday. Registration information is available on our website. And we will be hosting human service events again in 2014, so please check our website for an upcoming schedule. Thank you all very much.